Scapula, it levitates the scapula, I always think of. So unilateral contraction will produce side bending to the same side and rotation to the same side. And then scapular elevation and actually downward rotation a little bit too, okay? So once again, once I contract my levator scapula, which basically runs from the cervical spine down and attaches to your scapula. Other stuff possibly. Yep, lateral scapula. And it also runs from like your cranium and stuff, your atlas, or from your atlas and your axis, but atlas and axis, the top C1 and C2. So if it does side bending and rotation, the two activities that I want to do the opposite, to stretch it, where I want to be side bend to the opposite side and rotate to the opposite side, okay? Because the levator scapula is located a little bit on the back of the body, and we're also going to do the stretch the scalenes, which also do side bending and rotation. So if we want to differentiate that, scalenes are located more here, levator's back here. So with this one, I do side bend them and rotate to the opposite side. I usually would have patients' glasses off for this too. And then I would pull them down a little bit at a forward bias, okay? Once again, I'm stabilizing scapula, and I'm just kind of pulling them down a little bit forward bias, and you should feel maybe a little bit of stretch back in here. Or yes, or not quite yet. Yeah.
No,
Okay.
well, not quite yet. No.
Not quite yet. Is that a little bit
Yeah.
better? Okay. So side bend to the opposite side, rotate to the opposite side. Basically, you're looking down toward your opposite knee. Okay? Stabilize scapula. To teach the patient to do that themselves, once again, the VHI cards show that you can put your hand behind your back. Does it say? Oh, it says on the back of your head. I tend to do it underneath the chair because I think this is kind of awkward for patients to do. So I tend to teach it underneath the chair to stabilize the side. And then once again, you teach them to kind of almost look down toward the opposite knee, I say, and just go ahead and put your hand on the back of your head then. You're going to pull down kind of toward that armpit or toward the opposite knee, just making sure that this doesn't lift up too much. Okay?